wild. Okay, start, record, stop. Okay, I'm going to talk a little bit about gout. Now, gout, a lot of us know a little bit about. Gout, what is gout? Well, you eat a rich meal. Ben Franklin had it, and it's got uric acid. The uric acid forms crystals in the joints and it hurts, and that's about the limit of what most people know. It turns out that uric acid is an end point of metabolism in the body. It's a waste product, a leftover product of the metabolism of nucleic and ribonucleic acids, the things that make up DNA and RNA. Okay? All right, so what? It turns out that the therapy for gout is a couple of medicines, but in particular there's a medicine called allopurinol. And allopurinol is effective at decreasing gout because it inhibits an enzyme called hypoxanthine oxidase. And the reason I mention that is for the oxidase part. If you watch TV, you can see all kinds of ads for these wacky cleaners that have like oxides in them, peroxides and OxyCleans and things like that. That's because the peroxide, or the oxygen molecule with a couple of extra electrons on it, is a pretty powerful agent as far as a chemical. It cleans things, it torches things, it kills bacteria. And in your body, you make this peroxide through the hypoxanthine oxidase pathway. So, who cares? Well, recent research has looked at people with gout.
All clear. Code gray, all clear. Code gray, all clear.
And they've measured in large samples of patients their uric acid level. If you have a high uric acid level, you're likely to die. Recent research shows that high uric acid is associated with heart attack, stroke, and death. And if you get that diagnosed as having high uric acid and you take allopurinol and lower it, you decrease your chance of dying. And what they're thinking is that when the allopurinol blocks this peroxide creation, then the peroxides are less likely to go onto the lining of the blood vessels and cause the fat plus the blood vessels to harden into rocky, stiff, bad arteries. So they've done a lot of studies. For example, they took kids with high blood pressure, children with high blood pressure, and didn't give them high blood pressure medicine. They gave them allopurinol. Not for gout, but a gout medicine, and their blood pressure normalized. And they said, how could this be? And they think that the body of those high blood pressure kids was metabolizing some of this peroxide, stiffening the arteries and making the pressure go up. And when they blocked the hypoxanthine oxidase, less peroxide, less stiffening of the arteries. So one of the new theories is that we die as people as our own inflammatory clearance system hurts us. We have a civil defense system, and it's busy sometimes overreacting and harming us internally. It's as if our own police force started killing its own citizens. And if we can turn that down a bit with allopurinol, we may be able to help. Now, it turns out weight loss surgery is causes a tremendous decrease in uric acid and hypoxanthine oxidase and C-reactive protein and things like that. So there's real exciting new news that gout is a indicator of lots of uric acid, which is an indicator of lots of hypoxanthine oxidase, which may be an indicator of an upcoming stroke, heart attack, and death. So appropriately treating it with your allopurinol that you're on is important. There may be other things that can be done, like the supplement quercetin, which comes from the walls of oranges and other bioflavonoids may help also protect this, but also weight loss surgery may make a big difference. So there's a hot new area of research. Gout used to be just gout is arthritis, allopurinol. Now it may be a central part of the damage that leads to heart attack and stroke, and get your uric acid down, treat that, treat the blood pressure, may be a central pathway that leads to problems now that we see with heart attack, stroke, and death in the United States. So very interesting.